I'm Charles Bankhead of MedPage Today, reporting from the American Society of Clinical Oncology meeting in Chicago. Women with recurrent platinum-sensitive ovarian cancer had a 50% improvement in progression-free survival when the angiogenesis inhibitor bevacizumab was added to chemotherapy. The median progression-free survival was 12.4 months in women who received bevacizumab plus chemotherapy versus chemotherapy alone, as reported at the meeting. Dr. Carol Agajanian of Memorial Sloan Kettering Cancer Center in New York discussed the study during an ASCO press briefing.
In the OCEANS trial, patients with recurrent ovarian cancer who had measurable disease or visible disease on CT scan were entered. They were randomized to receive standard chemotherapy with carboplatin and gemcitabine with the addition of a placebo versus carboplatin and gemcitabine with bevacizumab. The placebo and bevacizumab were started with the first cycle of chemotherapy and given intravenously every 3 weeks until the time of disease progression. The primary endpoint of the study was met. The median progression-free survival improved from 8.4 to 12.4 months with a hazard ratio of 0.484. You can note that the curves separate at 2 months and maintain separation throughout. In addition, the patients had CT scans performed every 9 weeks from the cycle 1, day 1 of treatment. These CT scans showed an improvement in objective response rate for the women treated with the bevacizumab-containing treatment. There was an improvement from 57% response rate to 79% response rate with a difference of 21%. Furthermore, this response was of longer duration, 7.4 months median improvement to 10.4 months.
A review of adverse events showed no new or unexpected safety issues.
So in conclusion, the OCEAN study is a positive study. It shows that bevacizumab, in addition to a standard chemotherapy choice of carboplatin and gemcitabine, followed by bevacizumab until progression of disease, provides a clinically meaningful benefit in recurrent ovarian cancer. There was a 52% reduction in the risk of progression, with a median increase from 8.4 to 12.4 months. The safety data were reassuring and consistent with the known bevacizumab side effect profile. There were no gastrointestinal perforations seen on this study and no new safety signals.
Agajanian said the bevacizumab chemotherapy combination should be considered a new option for treatment of women with recurrent platinum-sensitive ovarian cancer. From the American Society of Clinical Oncology meeting in Chicago, I'm Charles Bankhead, MedPage Today.